Hi, I'm Kyle Newman. My pronouns are he, him, they, them. I represent the Civil Rights Education and Enforcement Center, or CREEC. CREEC is a national, legal, nonprofit based in Denver, Colorado. CREEC focuses on disability justice in settings ranging from healthcare to housing, protests to prisons, and more. With the generous support from the Colorado Health Foundation, CREEC has been investigating and helping to increase effective communication for deaf people in Colorado's healthcare system. Through CREEC's work, we found that many healthcare providers are not following the requirements of the Americans with Disabilities Act, or ADA. Specifically, they are not providing the aids or services, such as qualified sign language interpreters, necessary to ensure effective communication with deaf patients. Under the ADA, deaf patients have a right to effective communication. That means communication equal to non-deaf patients. It means clear and accurate information exchange. In other instances, healthcare providers were providing some aids or services, but not the ones preferred by the deaf patients. Under the ADA, deaf patients have a right to communicate using their preferred aids or services. In still other instances, healthcare providers were providing the patient's preferred aid or service, but the sign language interpreters were not qualified, or the VRI was unstable because of technology issues. Under the ADA, deaf patients have a right to a qualified sign language interpreter if that is their preferred aid or service. If a deaf patient is okay with VRI, they have a right to VRI that is stable and staff trained to use it. While these violations of the ADA can be brought to court, and CREEC has brought a number of these lawsuits and won, our goal is to educate healthcare providers about the requirements of the law to help them be in compliance and ensure effective communication with all patients. Now, the following 6 videos will go through a series of scenarios in which a deaf person is trying to access healthcare services. The videos go through do's and don'ts for healthcare providers and ways for people to advocate for effective communications.
Actually, I will need to change the appointment to next week or the following week to allow me some extra time to get approval from my supervisor and need more time to find an interpreter.
That is not fair that I have to wait for 1 week. Come on. I'm in so much pain. I need to get in tomorrow.
Okay, since we don't have an interpreter, I'll need you to help me with the appointment.
All right. They do not have an interpreter for you, and they want me to interpret it for you.
I have Danya here as your interpreter. I'm truly sorry about the problem with the VRI earlier, and I completely understand your point about having an on-site interpreter here so we can communicate clearly about your medical care.
Great. Thank you for understanding. I really appreciate it.
We also have made a guide with the legal requirements under the ADA. The website is linked here. We hope that this information is helpful and empowering. Please feel free to share these videos and resources as widely as possible. Take care.